Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. I guess you can see that I'm one of those people that made my decisions relative to masks. I would suggest that, after getting the advice of my physician, to get an N95 mask. So I'm just letting you know that I just took it off. That's your decision, but just letting you know what I know. Scott Poland, Dr. Scott Poland is our guest. He's a licensed psychologist, renowned licensed psychologist. He's nationally certified school psychologist and a professor of psychology here at NSU Florida. Dr. Poland, welcome. Good to see you. I'm glad to see you healthy and bright, and hopefully we bring some great information to our public that watches us.
Thank you. I'm very pleased to be here.
Good, sir. You know, I guess I started out, and again, this is this is up to anyone making their own decisions. But the bottom line is that no one can question that we're in the midst of a vicious pandemic. But the reason why I wanted to bring you to the viewers is because we've had so many, I guess you could say, inquiries from our viewers about their children, particularly. They say out of school, what effect does it have on them? They go to school and then they're told to do X, Y, and Z. But it seems to be, in essence, to put it in one little ball, there's a lot of pressure on a lot of young people, not only K through 12, but also at the level of the universities. So I figured that we would get what I know to be the expert, and that's you, Dr. Scott Poland.
Well, thank you for the opportunity to talk about mental health and how important it is. And it's every bit as important as medical health. You know, our Surgeon General just released a report about a month ago, protecting the mental health of our children, and a lot of concern about the isolation they experienced, the stress they've experienced, the disruption in on-campus, in-person learning. And, you know, I came up with a little model that I've been presenting on this topic now almost since the beginning of the pandemic. And the word calm is very important for all of us, trying to stay calm in the midst of all these things we can't control. But I wanted every letter of that word calm to stand for something. And I think we all have to think about what can we control, which is our reaction to what's going on. And you gave an excellent example of following medical advice. So we can work on controlling our reaction and the choices we make. And the A stands for really being alert to mental health challenges and worrisome behaviors, with whether it's our students, whether it's our own family members or our friends. Being available, and that being available leads to also listening, truly listening to the challenges that all of us are facing. And I think the L also has to stand for limiting television coverage. There have been times where I just couldn't watch the news anymore about the overwhelmed ICU, the story of someone who couldn't say goodbye to their lifelong partner, the portable morgues being located next to our hospitals. So we can control the news that we receive just to try to stay positive about what's happening around us. And the M, it's especially important for children. I'm really glad you focused on children. It's almost like the younger the child, the more they're going to look to mom and dad or teachers to see how upset to be about something. And I hope that all the adults watching are modeling hope and optimism for the future. with the idea that times are very difficult, but we will get through this.
You know, prior to this, I guess, insidious, what I call it's an insidious pandemic, which in essence, it looks like it's going to be an endemic the way the scientists have been presenting information, which means there's going to be a recurring situation year after year. You have to deal with the issues of mental health, not only because of this pandemic, but also for the general public. I mean, for example, here at Nova Southeastern, we have, almost a couple of thousand veterans who have come back with a great number of this whole compendium of mental health issues. Not every one of them, but a number of them do. And I can understand that, the PTSD issues and things of that nature. The reason I'm expanding a bit on it is because, again, the people are sort of reaching out to us and saying, what do I do? My kids are not in school, or I got to stay home, or I am home, and thank God I have a job and I can sit in front of my computer, but my kids are there. So that's the I guess the conundrum, the problem that we have. So what I'm doing is I'm reaching out to you. It's okay to just lay it out in a sequel of calm, but what do you say to the viewers? What should they be doing?
Well, self-care has never been more important. Unfortunately, some people have thought that self-care is somehow selfish. It's not. It's taking care of you so you can be that person to help all of your loved ones, your friends, and your family. And I think it's important we talk about what does comprise self-care. And basically, there's a physical part of self-care, which has to do with trying to eat in a healthy manner. It has to do with regular exercise, and it has to do with proper rest. But somehow I doubt that I'm the only person that during this pandemic, sometimes I just wake up at like 4:30 a.m. thinking about all the things I could worry about. But the challenge of getting proper rest is really, really important. Then there's a mental side of this, which has to do with, first of all, everybody has made mistakes during the pandemic. They've gotten really upset, angry, and especially when it's a parent and they have overreacted to a child, it's important to just apologize. I should have handled that better. I'm going to work on handling that better. So we don't need to hold on to mistakes and continually criticize ourselves for behaviors we exhibited when we were under stress. And we all have to figure out what works for us. What's a way that I can relieve stress? Ways that I could maybe be creative in things that I could do, like gardening or making sure I walk every day, or I call a friend, or maybe even finding the artistic side. And I like to give two examples. To be honest, I could tell that my partner was pretty depressed during the pandemic because we have all these grandchildren. She couldn't see them for months and months. So I did what a lot of people did. I actually bought her a puppy. And I spent more money for that designer puppy. I've bought cars for less. But that puppy, Taffy, has been incredibly helpful in just how responsive she is to both of us. And then my partner discovered paint by numbers, and she actually sits for hours, and it's relaxing for her. It's a way to manage the stress and worries that we all have about this world. Then there's two more points I'd like to make. There's a spiritual side to this. Lots of people are very involved in places of worship, the temple, the mosque, the church, and that's extremely valuable. But not everybody goes to a place of worship. Plus, we had periods of time where we we're kind of discouraged from gathering, even in a place of worship. But there's this spiritual side. And think for a moment if everybody had some values like always being compassionate, being respectful of others, being friendly, being helpful, and by the way, always trying to find humor whenever we can. And I think we've really been tested so many ways. We've had a pandemic. We've also had a very polarizing political climate. We've had racial unrest. And I have a quote here that I always try to get it right. It's from Gandhi, who basically says, our ability to be able to reach unity in diversity will be both the beauty and the test of our civilization. So we have been really tested in so many ways this last couple of years. And if everybody just lived by those values of being respectful to everyone, kindness, compassion, that's really what's needed. And there's one last point. We have to use what I like to call I can statements. I can get enough sleep by doing this. I can eat in a healthy manner. I can manage this. And I like to ask everybody to try to think about how can you be that positive person for everyone, that we will get through this. We will use our families, our faith, our workplace. We will get through this together.
You know, you bring a couple of points forward, which questions came from our viewers. One of which has to do with the availability of religious venues, whether they be churches, synagogues, mosques, etc. Many of them are closed. However, just personally, I go online, and I find it to be very soothing. Maybe that's not a technical, articulate medical term, but I know how I feel inside. I find myself being part of a generational, I guess you could say, connection to my grandparents and my parents and my brothers, because I remember the times that we would enter into that type of facility and be there for each other. Is that the type of thing that you're talking about?
Yes, absolutely it is. In being that positive person for everyone around us. And, you know, there are times that we all get overwhelmed. And there's one quick concept I'd like to mention. It's called worry time. So that means I say to myself, tonight between 7 and 7:20, that will be my worry time. I'll have all these thoughts then about the challenges of living right now. But at this moment, I will focus on what is right in front of me. You know, that's the big concept of mindfulness. Is part of it is keeping our brains and our body busy, focusing on what's right in front of us. You know, and as a psychologist, I would say to you, Dr. Lippman, I've never been busier than the last 2 years. And that actually has been really helpful because I have things to do every day. And that stops me from having all these thoughts of the things out there that I can't control. So children in particular do the best with routines. And even during the time of virtual learning, I was recommending kids got to get up at a regular time. They got to get dressed. They got to get in front of that computer screen. They need that day that is basically organized for them. But, you know, some high school kids said something that I thought was really astute. So they say, you know, virtual learning, I sit in front of my TV or my screen actually for hours and hours, and then they give me homework. The question they asked was, why can't the homework be about self-care? And I think in our workplace, our university, and in our K to 12 schools, we have to build self-care has to be something that even after this pandemic is hopefully long gone, everybody remembers there's certain strategies we need to take care of ourselves.
You know, just as you were talking, again, I guess I'm at a point in time where I'm called mature. Are there center points? Is that, I mean, for example, during my life, I've seen World War II, the Korean conflict, which was a war, the Vietnam conflict, which was a war, and then everything else that's come about over the last 20 years. Uh, do you see any relationship now to the types of stress that is placed upon people based upon something they have no control over, which is the pandemic? In a sense, they have no control. They do have some elements of control, but I'm not going to get into that issue. But do you see a relationship to that type of feeling?
Well, absolutely, I do. And it certainly sounds like your family instilled in you a sense of compassion and empathy and care for others, which is something we really need now. You know, when you mentioned several of the wars that have been fought, and certainly that had, very pervasive impact on lots of people, but not necessarily everyone. For example, I was in the military at the time of the Vietnam War. And for those of us that were soldiers and our family greatly impacted, but for most Americans, that was something that was far away. This pandemic is something in every community, every school, every neighborhood. So the pervasiveness of that. And I think it's also important that I say just a couple of things, which is, first of all, everybody has a story to tell about the impact of the pandemic on their life. But in particular, who should we be the most concerned about? When you mentioned mental illness and earlier, so who had a pre-existing mental illness or mental health problem before a pandemic? Then we also have to look at who lost a loved one. We've lost over 800,000 Americans. There's estimates that maybe as many as 6 million of us are grieving the loss of somebody to the pandemic. And many of those are children that lost a caregiver. And then we have a lot of families that experience financial hardship. And so, that Surgeon General report, although it focused largely on our young people, the challenge is mental health services available to everybody, not just those that happen to have good health insurance, for example, or be affluent. This is a time when hopefully we can promote mental health and self-care for everyone.
Going back to your colleague Gene Cash, Dr. Cash, it was unbelievable when he started to lay out the numbers and telling me and our viewers that the greatest increase in suicide was between the ages of 9 and 17. It was astounding to me just sitting here listening. But, I try to relate to it and say, where are we relative to waking up and recognizing that this is not an illness, this is not a cold. You don't blow your nose, you don't take cough medicine, you don't take an antibiotic. You have to get some help because there's maybe non-knowledge or the absence of relationship to what's happening around these 9 to 17-year-olds. And am I correct in saying that one of the sequelae of this pandemic is the element of suicide?
Absolutely. Unfortunately, as you just stated, suicide is now the second leading cause of death for children 10 and older. And, there's lots of issues, but undertreated mental illness in combination with adverse childhood experiences, and certainly the pandemic has been an adverse childhood experience. And as a result of this, as you know, a big part of my career has been suicide prevention in schools. And with the help of NSU, we have developed what I call the Florida Steps School Toolkit for Educators to Prevent Suicide. And hard copies have been shared with every superintendent in our state. And in the Suicide and Violence Prevention Office, we do a lot of training. And what's really holding back suicide prevention? We're all afraid of the word. We don't want to use it. We are afraid to ask. And I just read a story from Congressman Raskin. He lost his college-age son to suicide about a year ago. And he said things like, I could tell Tommy was really troubled. I was worried about him dying by suicide, but I was just afraid to bring that up. I was afraid if I said the word, that would plant the idea. The problem is we don't talk about it. And if we ask people directly, they're probably going to tell us the truth. Then we know what we need to do to keep them safe. Do we need to go to an emergency room? Do we need to keep a lethal means away from them? Do we need to get them into one of our clinics? So suicide is a tremendous challenge. And there have been dire predictions because the suicide rate in America was really at or near an all-time high before the pandemic. And isolation is a critical factor with regards to suicide. And lots of people have really been isolated for periods of time.
We're down to the last 45 seconds of the show. And I'm saying to you that I'm proud to have had you as a participant in this broadcast, because I know that normally when we do these shows, and we've been doing it for well over 21, 22 years, we always talk about, surgery and medication and a lot of different things that have to do with the beauty and the magnificence of knowledge in healthcare and the development of new techniques. But I felt compelled to talk about mental health, and I'm very, very pleased, Dr. Scott Poland, that you took your time and enabled us to get some insight, because this is really something that we need to pay attention to. And we're blessed to have you at NSU, and anything that we could do as a total community, we are in back of you. So thank you very much for being here today. Thank you. Folks, I know it's not necessarily a very pleasant and an up meeting of discussions and minds here, but I thought it would be very important to talk about mental health at this point in time. Remember, we have little children, we have growing children, like you mentioned, Congressman Raskin's child. We have people that are necessary to deal with these problems, people like Dr. Scott Poland. So thank you very much for showing up today. Remember, this program is called Dateline Health. Before I cut off, I'm going to tell you that if there's any problems, whether they're healthcare problems, whether they're mental health problems, you got to talk to your physicians. You have to get the knowledge to other people. Let them help you help yourself. So remember, this program is called Dateline Health. My name is Fred Lippman. Until next time, see you.